Good day related to COVID. Given a briefing today, I'll be out of the area on Thursday at a conference. Um, but positive day, worth talking about, worth celebrating to a degree. No new deaths over the last 24 hours. We've lost 710 of our residents since the pandemic began for our community on March 16th of 2020. 7-day rolling average, even though not a big fan of this anymore with the limited testing in the community, continues to drop 0.8%. Overall, we've now had 37,891 positive cases. That is 5 new cases today. That's certainly the lowest case number we've had in months, certainly in 2021, but probably even going back to last summer. Active cases are under 100 at 94. Again, that's probably the lowest active case number we've had since the second week this all began. So really good news there. Hospitalizations are down to 20 of our residents in the hospital, and 6 of our residents are in the ICU. Certainly, we need to keep them all in our thoughts and prayers so that they can get home to their families. But overall, looking at the data, we have turned a corner. Right now, there's probably more people in the community with an active case of a stomach bug or another ailment than COVID, and I think that's a very good thing moving forward as we try to recover from this pandemic, both personally, economically, socially, for our community. From the vaccinations, again, this week we're doing second shots, 12 to 15-year-olds, and are starting on the 22nd of the month. We'll have weekly vaccine clinics at the Civic Center every Tuesday. We'll also continue to work in the zip codes that we have had the least amount of success in to date with our mobile teams. If we have a partner that's interested in a pop-up clinic, that's fine. But what we have done now is we essentially have mobile teams of 2 to 4 healthcare professionals out of our health department that we can go and work with. But certainly we're not going to staff a 10-person operation if we don't know we have people coming in to get the shots. So we'll continue to work with credible messengers and partners in those zip codes that are underperforming, and the work's not done with the vaccinations. The vaccine's really important to continue to do this. It looks like we are getting to a very good place here going into the summer, but certainly going into the fall and the winter, we need to continue to build up that immunity. If you think about what we've done with this virus at essentially 61% vaccination rates, certainly if we could get that number to 70 total, I think we'd really put this thing behind us. A couple other relevant topics. Yesterday, we went out with the rest of the unclaimed vouchers for our restaurant gift card program. They were gone. The $75,000 was gone within 18 minutes. To give you an idea, the link had 1,000, at most 1,000 hits on it per day. Yesterday it had 132,998 in 18 minutes. For 9 minutes there was, it did not crash, but it was delayed. It had 60,000 unique visitors, so certainly some people kept on clicking and clicking. Maybe it was a family effort with some of the feedback I've heard with people trying to get it. But certainly the program's a wild success. I understand people may be frustrated if you didn't get a voucher. We will do another round, and we'll talk about that probably next week. But remember, we had saved $25,000 worth of vouchers for seniors. I'm happy to report that we had 20 callers taking calls today, and those $25,000 worth of vouchers went in 2 hours to seniors who certainly weren't as, we wanted to make it more accessible so those who maybe are not as tech savvy had the opportunity to participate. So essentially, $100,000 will generate at least another $100,000. Most estimates will show that this $100,000 will probably get us close to a $300,000 impact for our local businesses. Again, we're proud of the program. We'll look at any improvements we can make to the process moving forward, but certainly we will do another round and talk about that. In addition to that, we will be looking to have some support for our arts and cultural organizations, and next week we'll talk about that and ways we'll do that. We have various initiatives that we're going to do to support our arts and cultural organizations as well and help them recover from the pandemic. So we'll talk more about that. Before I take any questions from Tim or anyone else, we are no longer in emergency responding to COVID-19. From the public health standpoint, I'll be reviewing all emergency orders on Monday, assuming the data continues to go where it is going. I will not be signing many of those orders moving forward. We may continue some of our emergency orders that specifically impact the economic situation in the community. Think of outdoor dining, the outdoor dining order where we allowed outdoor seating without certain zoning and whatnot. We don't necessarily see that situation being resolved, so we may keep that emergency order and some other ones in that ballpark. But when it comes to responding to COVID-19, neither the County of Onondaga or the State of New York is no longer really in an emergency. So hopefully we'll start to see some of these restrictions move forward, and we can continue to focus on vaccinating, but also recovery. There's many things going on in the community that are related to what we've all been through for the last 16 months, and we need to address those issues. So saying that, happy to take any questions.
So it's kind of tempting, given where we are, to think of this pandemic as, not over, but well under control. So what do you see next on the horizon as your priorities?
Yeah, so I think we'll continue to intentionally vaccinate in our city neighborhoods and a couple suburban neighborhoods. I think right now we really need to re-engage with all of our partners in the human service world to get things focused in on. One of the things, Tim, that we're doing now is our health department. It has to, all of our teams that have been so focused on COVID need to start transitioning to other public health issues that are probably a little bit more of an emergency at this point when you look at our opioid crisis. So that even means our data people, who have just been doing this for us all the time, now have to start doing other things. So we have those issues. Our partners need to come together when we look at some of the youth violence specifically in the community that we've been witnessing. We all have a role to play in these positions. Make no mistake, a lot of these violent acts, these aren't necessarily gang-related acts where there's a narrative behind it. What role has the isolation played and all of the stress of this all played on these young people, and addressing those issues, and then getting back to really the economic opportunities that we think there will be, and getting people who need a job to the job. These are all things we were focused on pre-pandemic, and I think we need to re-engage and double down on that. We have to move forward, and that's hard for a lot of people who've been doing this every day.
Yeah, and it is kind of, depressing the way the youth violence and mental health repercussions are kind of playing out. What role can the county play? Is there like a chance for amped up rec programs,
Yeah.
summer jobs?
Yeah. If you look at, so the mayor and I talked about our summer jobs program, and again, I think when we announced that, if there's more businesses that come forward for participation, we will get those slots filled, and we will do that. when you look at opportunities for people to be together, we need our partners back at work, back to providing the services that we've relied on them for years to do. Um, you know, we need to get some of these businesses back open. And for some of that, that means that you need to get people back to work with some of the enhanced unemployment benefits that are there. And certainly there's some cases with the enhanced unemployment benefits where there may be some issues related to child care and other things, or the timing of it. We know that there's slots available because we track that daily. So it's complicated, but the mental health initiative we have, I think we have every school district signed up except for one at this point going into the fall. So these are all things we talked about, the other victims of this pandemic who didn't physically get sick. We're seeing this play out in our community now, and that's where our focus needs to be on the human services side, on stimulating the economy, getting major infrastructure projects done. We have teams that are doing that and that have been doing this, and we'll continue to do that. But there's a lot of work to do with our residents right now to heal from this.
Ryan, can you touch more on like what it means that the county is no longer in like a COVID emergency, just if people have questions about that?
Yeah, so really right now, think about this, out of a 10-day period, right? Logging 10-day period, we have 94 cases, active cases. So certainly that's not, it is not an emergency for us to respond to. Hospitalizations are at 20. That is not an emergency. The ICU number is not an emergency. So I think overall, on the public health infrastructure, we're no longer in an emergency. There's been a lot of work to get here. The public's done a very good job to get here, and being smart and really taking the situation seriously. So I think when you look at some of the restrictions, when you're, and again, this is important for some of the work we still have to do with the vaccines and vaccine hesitancy. If people are hesitant to get a vaccine because they say nothing's going to change, when the emergency is over, even if it's over for months before we go into the fall, and something else happens, a new variant happens or something else, which I don't think it will, but the government needs to react and find balance. And so I think it's important that all governments find balance now, because we still need to get people vaccinated. And part of the vaccine hesitancy I hear all the time is nothing's going to change if I get the shot. So in Onondaga County, the orders that I've signed, many of them will change, because we are no longer in an emergency situation responding to the virus.
Can you give an example or two of some of the orders that you'll likely?
Yeah, I'll probably get rid of almost all of them, Tim, except for the ones that have to deal with economics. So I got to go back through them. I'll review them with law. Law is going to do that, but really, you need these powers only for the emergency at hand. And I got rid of 4 or 5 of them a couple weeks ago and stopped signing them. But whether they impact the day-to-day lives of people, probably not so much, but it's more symbolic that we need to move forward, and we need to continue to vaccinate. We need to continue to now address the other public health issues at hand, whether it's mental health, whether it's opioids, whether it's suicide, whether it's food security, because these are all have been areas where all of our infrastructure as a community has all gone into COVID, and now we got to rebalance that infrastructure.
When you do mobile vaccinating in neighborhoods, will that be like with a van?
Yeah, you normally, potentially, we could use our emergency management infrastructure for sure going in, but most likely, Dr. Gupta's teams will, go out, and we may have, 5, 6, 7 folks that we can line up and get in one spot, and we'll go and vaccinate. If we can go in a coordinated fashion with credible messengers and go into an apartment complex and we got 20 or 30 different people there, that's a lot better for us. But again, I think we can no longer justify taking 10 or 20 individuals and have them sitting in a facility for 6 hours in a day waiting for people if nobody is going to come. especially when we have all these other issues that we need to get ahead of.
Is there anything new to report on your economic stimulus plan?
So we're moving. We're we've continued to receive guidance on pots of money and on how lost revenue is calculated. And the lost revenue is really what allows us to have the flexibility with the money outside of the regular guidance. So I believe our new lost revenue calculations through the current date are about $76 million. We are allowed to calculate certain lost revenue in 2021 and 2022 as well. So it will be likely that the entire $89 million we received will be lost revenue. That gives us the ultimate flexibility to use the money. So we are, many of the initiatives that we highlighted are in the planning process. Some of them almost ready to move forward to the legislature to talk about the process. Anytime we need to, if we're building something, we need the legislature's approval. I don't need appropriation authority. I receive that in the budget. But certainly, when we're talking about our multi-sports complex, which is coming up, a sports tourism project that will go to the legislature for their feedback and likely their approval, because we're building a facility. We are in the early stages of looking at renovations to the On Center. We are mid-level stages with planning for the Carnegie Library renovation. We are probably past mid-level with our broadband process. The survey by the Central New York Regional Planning Board is being done, and that will be completed in July. And that will kind of give us a lot of information to then go figure out a solution to bring broadband and affordable internet coverage to all areas of the county. And then we have certainly our mental health initiative is probably the closest to being completed, but for next year's school year, where we'll be putting 3 levels of support in the schools in every district, including mental health clinics for our kids and their families. And so there's various initiatives. We're very close to coming out with applications for capital improvement projects for our municipal partners, as well as our Main Street and Town Center program for our municipal partners to really focus in on developing downtowns and town centers. The Alliance for Economic Inclusion is moving forward. Money will start flowing there shortly. We're talking about over 20 various poverty initiatives to try to remove barriers to the workplace. So there's a lot, and we're getting very, very close on that. Some of the late due diligence on some of the projects we think are almost ready, and so then we'll be talking about those in short order. And we still have a couple other major initiatives that we are working through. Again, we probably would have liked to have talked to them about the state of the county, but we just weren't even really prepared to do that because of where they were in the planning stages. So, but we'll be talking a lot about support for our hospitality industry and our arts and cultural organizations over the next few weeks, and certainly we'll be kicking off our Main Street and Town Center application process in the next few weeks as well. And hopefully some of the bigger ticket items will be sending over to the legislature to review at committee in the next 2 to 4 weeks.
Hey, the primaries are coming up soon. Who would you like to see become the next mayor of Syracuse?
That's a good question. So I have not been asked to endorse a candidate, and I don't know if I will be asked to endorse a candidate. I'll probably hold an endorsement for the general election, but it's no secret, Tim, that I have a good working relationship and a friendship with the existing mayor. That's no secret. All the candidates know that.
That's almost an endorsement.
It's a fact, right? It's not an endorsement. It's just a fact. And so, but I've not been asked to endorse anybody by any of the candidates. Any other questions? All right. Let's see you, folks. Thank you.